Yeah, starting. Hi, I'm Melissa. I'm gonna talk about the trauma decision tree. Alright, let's just start off. I'm gonna ask you a question. Raise your hand if you've ever witnessed improper delivery of a trauma patient to a local facility in healthcare. Okay. By categorizing a trauma patient correctly using the guidelines in the trauma decision tree, there is less risk for injury or adverse outcomes. I have experienced this as I am an EMT and I've worked in the field and dealt with trauma calls in pre-hospital care. I also have a strong passion for helping others when it comes to healthcare in general. Being that the chance of traumatic injury increases as the aging population increases and technology increases, it's imperative to understand where people should be placed on the trauma decision tree if they sustain a traumatic injury. I'm going to discuss how to categorize trauma patients effectively, the importance of delivering trauma patients with certain categories to the correct hospital center, and the importance of time when it comes to effectively categorizing and transporting them. Furthermore, I'm going to review specific incidences where the mistakes are more often made with trauma. First off, the risk of patient injury or adverse outcomes decreases when patients are categorized properly with a trauma decision tree. According to the emergency medical system protocol, of course they were updated in July 2019, proper categories for the trauma decision tree are Alpha, Bravo, Charlie, and Delta. Excuse me. Each category in the trauma decision tree has different criteria. Alpha would be your altered mental status, or if their vital signs are abnormal for their age. For example, you would have, if you had someone with a heart rate 200 and their blood pressure is hypotensive at 80 or 50, that would be abnormal if it's outside of that patient's range. This also includes respiratory rate, which most people don't think of. Bravo patients are musculoskeletal injuries. That could be 2 proximal long bone fractures, most people femur fractures, you could have hip fractures, any major injuries. Charlie patients, we categorize them as our mechanism of injury. Most often this would be car accident, like if there was a rollover or ejection, if they were on a high speed, any of that would be considered trauma category there. The last category would be a Delta. This is our special patient populations, the elderly over 65, you have burn patients, and if they're on anticoagulants. Next, we're going to talk about how trauma patients can be delivered to a local hospital or trauma center based on their condition. Alpha and Bravo patients typically always go to your trauma center. They have more resources. Unless you need stabilization, you can go to a local hospital if they were coding or anything. According to the NCBI, traumatic brain injuries shows that 47.9% of brain injuries were seen at a level 1 or 2 trauma center. It also increased their chance of survival and better outcomes. Category Charlie and Delta patients, they can be seen at a local hospital. It just depends on the circumstances. From field experience, the most common Delta or Charlie or Delta, depending on, it would normally be a Charlie, would be falls. You get a lot of vets home patients that fall and they're on blood thinners and they bump their head. They're getting better about it, but local hospitals will normally send them up the road. So after that, we're going to talk about how patients need to be transported to either the local hospital or trauma center in the least amount of time possible. We have a topic called Golden Hour that we recommend. It's within an hour of you getting there, you should have the patient to either the local hospital or trauma center. Journalist resource recommends that any trauma patient be transported within an hour of arrival, beginning of treatment in emergency medical systems. That would be what they quoted as a golden hour. The golden hour is also a tool reference, like I said, in our protocols. Lastly, there are several ways in which patients can receive optimal outcomes from traumatic injuries. Follow the guidelines for your protocols. They're right here. The trauma decision trees on 174 if you guys want to reference it. And stay within your scope of practice there. Use your best judgment for EMS protocols to decide whether the patient should go to a local facility or trauma center. You always have the hospital and MedPatch if you have any questions. Also remember the golden hour and try your best to get them there within that 60 minutes. The longer you take, there will be more adverse outcomes. In conclusion, transportation of trauma patients to an inappropriate facility can cause patients to suffer a lot more adverse outcomes or even cause more injury in some cases. With the incidences of traumatic injuries increasing lately, it is best to fully understand your protocols and guidelines for your local hospital and your pre-hospital care, wherever you volunteer or if you're paid. We all wish the best for people, especially after trauma situations, so these patients need the best care possible. Thank you for listening. Any questions while that's going around? Okay, thank you.
If you need questions, I'm sure we can think of some, but maybe like pause and think of some and then continue with the video.